Top 20 most challenging NCLEX questions. Mastering high failure topics with detailed rationales and key concepts. One. Priority setting. Maslow's hierarchy of needs. Question. A nurse is caring for 4 patients. Which patient should the nurse see first? A patient with COPD who has an oxygen saturation of 90%. B. A patient with diabetes who has a blood glucose of 250 milligrams per deciliter. C. A patient with pneumonia who has a respiratory rate of 32 breaths per minute. D. A patient with chronic kidney disease who has a potassium level of 5.2 milliequivalents per liter. Correct answer. C. A patient with pneumonia who has a respiratory rate of 32 breaths per minute. Rationale. Correct. A respiratory rate of 32 indicates respiratory distress, which is a high priority problem that could progress to respiratory failure. Airway and breathing take precedence over metabolic concerns. Incorrect answers. A. While an oxygen saturation of 90% is slightly low, it is expected in a COPD patient. B. A glucose of 250 milligrams per deciliter is high, but does not require immediate intervention. D. A potassium level of 5.2 is slightly elevated but not critical. Key concept. Prioritization is based on the ABCs: airway, breathing, circulation. When deciding which patient to see first, always assess which condition is life-threatening. A patient in respiratory distress, increased respiratory rate, low oxygen saturation, or difficulty breathing takes precedence over metabolic issues. Maslow's hierarchy of needs, physiological needs, airway, breathing, circulation come before psychological or social needs. 2. Fluid and electrolyte imbalance. Question. Which assessment finding is most concerning for a patient with severe hypokalemia? A. Muscle weakness. B. Irregular heart rate. C. Nausea and vomiting. D. Fatigue. Correct answer. B. Irregular heart rate. Rationale correct. Hypokalemia can cause cardiac arrhythmias, which can be life-threatening. Incorrect answers. A, C, and D. While these symptoms are associated with hypokalemia, they are not immediately life-threatening. Key concept. Potassium plays a vital role in cardiac function. A normal potassium level is 3.5 to 5.0 milliequivalents per liter. Hypokalemia less than 3.5 milliequivalents per liter can cause cardiac dysrhythmias, muscle weakness, and cramping. The most dangerous complication is life-threatening arrhythmias, e.g., ventricular fibrillation. Potassium must be replaced cautiously, never give an IV push. 3. Delegation, scope of practice. Question. Which task can the nurse delegate to an experienced, unlicensed assistive personnel, UAP? A. Assessing a patient's pain level. B. Administering a subcutaneous insulin injection. C. Teaching a patient about medication side effects. D. Measuring and recording urine output. Correct answer. D. Measuring and recording urine output. Rationale correct. UAPs can perform non-invasive tasks such as measuring and recording output. Incorrect answers. A, B, and C. Assessment. Medication administration and teaching require a licensed nurse. Key concept. The RN is responsible for tasks that require critical thinking and assessment. UAPs can perform non-invasive tasks such as vital signs hygiene and recording intake output. Licensed practical nurses or licensed vocational nurses can administer some medications but cannot perform initial assessments or teach. RNs must handle assessments, medication administration, except in certain cases, and patient education. Use the 5 rights of delegation: right task, right circumstance, right person, right direction/communication, right supervision/evaluation. 4. Pharmacology, opioid overdose. Question. A patient receiving morphine for pain relief is difficult to arouse and has a respiratory rate of 8 breaths per minute. What should the nurse do first? A. Administer naloxone. B. Apply oxygen via nasal cannula. C. Place the patient in a side-lying position. D. Notify the healthcare provider. Correct answer. A. Administer naloxone. Rationale. Correct. Naloxone reverses opioid overdose and should be given immediately. Incorrect. B and C. Supportive measures are helpful but do not address the root cause. D. While important, it is not the immediate priority. Key concept. Opioids depress the central nervous system, CNS, leading to respiratory depression. Signs of opioid overdose. Slow, shallow respirations. Less than 10 breaths per minute. Pinpoint pupils, miosis. Decreased level of consciousness. Naloxone, Narcan, is the antidote for opioid overdose and should be administered immediately. Respiratory support, oxygen ventilation is critical. 5. Mental health, therapeutic communication. Question. A patient states, I feel like my life is not worth living. What is the best response by the nurse? A. You have so much to live for. B. Are you thinking about hurting yourself? C. Try to focus on the positive aspects of your life. D. Don't talk like that. Everything will be fine. Correct answer. B. Are you thinking about hurting yourself? Rationale. Correct. Directly assessing suicidal intent is critical for patient safety. Incorrect. A, C, and D. These responses dismiss the patient's feelings and do not assess suicide risk. Key concept. Always assess suicidal ideation directly. Patients expressing hopelessness or suicidal thoughts must be evaluated immediately. Use open-ended, non-judgmental communication. Avoid minimizing feelings or giving false reassurance. e.g., everything will be fine. A nurse must ask about suicidal thoughts to determine the level of risk and ensure safety. 6. Maternal newborn, eclampsia. Question. A pregnant patient at 32 weeks has a blood pressure of 160/110 and reports a severe headache. What is the nurse's priority action? A. Give acetaminophen for the headache. B. Obtain a urine sample for proteinuria. C. Assess deep tendon reflexes. D. Prepare for seizure precautions. Correct answer. D. Prepare for seizure precautions. Rationale? Correct. Severe hypertension and headache are signs of impending eclampsia, which requires seizure precautions. Incorrect. A, B, and C, important but not the priority. Key concept. Preeclampsia can progress to eclampsia, causing seizures and organ damage. Key signs of severe preeclampsia. Hypertension, greater than or equal to 160/110 millimeters of mercury. Severe headache. Visual disturbances, blurry vision, floaters. Proteinuria. Hyperreflexia, brisk deep tendon reflexes. Seizure precautions must be implemented, e.g., padded side rails, oxygen, suction. Magnesium sulfate is the drug of choice for preventing seizures. 7. Cardiovascular, heart failure. Question. Which dietary instruction is most important for a patient with congestive heart failure? A. Increase potassium intake. B. Avoid sodium-rich foods. C. Drink more fluids. D. Eat a high-protein diet. Correct answer. B. Avoid sodium-rich foods. Rationale. Correct. Sodium causes fluid retention, worsening heart failure. Incorrect. A, C, and D. While these may be relevant, sodium restriction is the most critical intervention. Key concept. Heart failure leads to fluid retention and requires sodium restriction. Sodium causes water retention, worsening fluid overload and edema. Daily weights are the best indicator of fluid status. Other interventions, diuretics, e.g. furosemide D, remove excess fluid, monitor for pulmonary edema, dyspnea, crackles, pink frothy sputum. Teach patients to avoid processed foods and salty snacks. 8. Diabetes management. Question: which symptom is most concerning in a patient with diabetes? A. Frequent urination. B. Sweating and tremors. C. Weight gain. D. Increased thirst. Correct answer: B. Sweating and tremors. Rationale. Correct. These are signs of hypoglycemia, which is life-threatening. Incorrect. A, C, and D. These indicate hyperglycemia, which is concerning but not as immediately dangerous. Key concept: hypoglycemia, low blood sugar, is more immediately dangerous than hyperglycemia. Normal blood glucose range, 70 to 110 milligrams per deciliter. Signs of hypoglycemia: low blood sugar less than 70 milligrams per deciliter, sweating, tremors, confusion, irritability, tachycardia. Treatment: give fast-acting carbohydrates, e.g., orange juice, glucose tablets. Hyperglycemia symptoms: polyuria, polydipsia, polyphagia, develop slowly and are less life-threatening in the short term. 9. Respiratory, COPD. Question: which finding indicates worsening respiratory status in a patient with COPD? A. Clubbing of fingers. B. Barrel chest. C. Increased confusion. D. Prolonged expiration. Correct answer: C. Increased confusion. Rationale. Correct. Confusion indicates CO2 retention and possible respiratory failure. Incorrect. A, B, and D. Expected findings in COPD, but not signs of acute deterioration. Key concept: COPD patients retain CO2, which can lead to confusion and respiratory failure. Signs of worsening: COPD, increased confusion, CO2 retention. Increased work of breathing, accessory muscle use, pursed lip breathing. Decreased oxygen saturation less than 88% despite oxygen therapy. Avoid excessive oxygen administration, as COPD patients rely on hypoxic drive to breathe. Treatment includes bronchodilators, steroids, and controlled oxygen therapy. 10th. Endocrine, thyroid storm versus myxedema coma. Question: a patient with a history of hyperthyroidism is experiencing a fever, tachycardia, and extreme restlessness. What is the nurse's priority intervention? A. Administer a beta blocker. Begin initiate seizure precautions. C. Give levothyroxine. D. Provide warm blankets. Correct answer: A. Administer a beta blocker. Rationale. Correct. Thyroid storm is a life-threatening condition causing excessive thyroid hormone release. Beta blockers, e.g. propranolol, help control tachycardia and hypermetabolism. Incorrect. B. Seizures are not the primary risk. C. Levothyroxine is used for hypothyroidism, not hyperthyroidism. D. Warming is needed for myxedema coma, hypothyroidism, not thyroid storm. Key concept: thyroid storm, life-threatening hyperthyroidism, causes severe tachycardia, high fever, and hypermetabolism. Immediate treatment includes beta blockers, e.g. propranolol, to control heart rate. Cooling measures for hyperthermia. Antithyroid medications, PTU, methimazole, to suppress hormone production. Myxedema coma, severe hypothyroidism, presents with bradycardia, hypothermia, and respiratory depression, and requires IV thyroid hormone replacement and warming. 11th. Neurology, increased intracranial pressure, ICP. Question: which sign is most concerning in a patient with a head injury? A. Vomiting. B. Headache. C. Bradycardia and hypertension. D. Irritability. Correct answer: C. Bradycardia and hypertension. Rationale. Correct. Cushing's triad, bradycardia, hypertension, irregular respirations, indicates increased ICP, which is life-threatening. Incorrect. A, B, and D. These are early signs of ICP, but not as critical as Cushing's triad. Key concept. Key concept. Increased ICP can lead to brain herniation, which is fatal. Cushing's triad, hypertension, bradycardia, irregular respirations, is a late sign of increased ICP and requires emergency intervention. Early signs of ICP: headache, nausea, vomiting, restlessness, altered mental status. Interventions to reduce ICP: raise head of bed 30 to 45 degrees to promote drainage. Give mannitol, osmotic diuretic, to reduce cerebral edema. Avoid activities that increase ICP: coughing, straining, excessive stimulation. 12th. Pharmacology, warfarin therapy. Question: which statement by a patient taking warfarin indicates a need for further teaching? A. I will avoid leafy green vegetables. B. I need to have my Indian rupees checked regularly. C. I should use a soft bristled toothbrush. D. I can take aspirin for pain relief. Correct answer. D. I can take aspirin for pain relief. Rationale correct. Aspirin increases the risk of bleeding in patients on warfarin. Incorrect. A, B, and C. These are correct precautions for warfarin therapy. Key concept. Warfarin, Coumadin, is an anticoagulant used to prevent blood clots. DVT, PE, stroke and atrial fibrillation. Important considerations: monitor INR. 2 to 3 is therapeutic range. Avoid aspirin, NSAIDs, and alcohol. Increase bleeding risk. Limit vitamin K intake, found in green leafy vegetables, to keep Indian rupee stable. Use soft bristled toothbrushes and electric razors to prevent bleeding. Reversal agent, vitamin K. 13th. Cardiac, myocardial infarction, MI. Question: which symptom in a patient with chest pain is most concerning? A. Pain relieved by rest. Bilateral substernal pain radiating to the jaw. C. Pain occurring after a large meal. D. Sharp pain that worsens with deep breaths. Correct answer. B. Substernal pain radiating to the jaw. Rationale correct. Classic sign of myocardial infarction, MI, requiring immediate intervention. Incorrect. A. Angina, not MI pain, improves with rest. C. Likely GERD, not cardiac related. D. Pleuritic pain, worsens with breathing, is often pulmonary related. Key concept: heart attacks, MI, occur due to blocked coronary arteries cutting off oxygen supply. Classic signs: chest pain, pressure radiating to the jaw, left arm or back. Diaphoresis, nausea, shortness of breath. Women and diabetics may have atypical symptoms: fatigue, indigestion. Immediate interventions: MONA, morphine for pain, oxygen if SpO2 less than 90%, nitroglycerin 14, GI, peptic ulcer disease. Question: which finding is most concerning in a patient with peptic ulcer disease? A. Hematemesis, B. Dyspepsia, C. Bloating, D. Belching. Correct answer. A. Hematemesis. Rationale correct. Vomiting blood indicates a bleeding ulcer requiring immediate intervention. Incorrect. B, C, and D. Common symptoms but not immediately life-threatening. Key concept: peptic ulcers are caused by H. pylori infection or NSAID overuse. Complications: GI bleeding, hematemesis, melena, black stools, requires immediate intervention. Perforation, severe pain, rigid abdomen is a surgical emergency. Management: avoid NSAIDs, alcohol, smoking, and spicy foods. PPIs, omeprazole, and H2 blockers, ranitidine, reduce acid production. Antibiotics, clarithromycin, amoxicillin, eradicate H. pylori. 15th Pediatric, croup versus epiglottitis. Question: A child with a fever, drooling, and tripod positioning is suspected of having epiglottitis. What is the priority intervention? A. Suction secretions. B. Apply a cool mist humidifier. C. Prepare for intubation. D. Administer cough syrup. Correct answer. C. Prepare for intubation. Rationale correct. Epiglottitis can cause airway obstruction, requiring emergency intubation. Incorrect. A, B, and D do not address the airway emergency. Key concept: epiglottitis, medical emergency, is caused by Haemophilus influenzae type B, Hib, and leads to sudden airway obstruction. Drooling, stridor, high fever, tripod positioning indicate respiratory distress. Do not inspect the throat as it may worsen obstruction. Prepare for intubation. Croup, laryngotracheobronchitis, is less severe and presents with a barking cough and inspiratory stridor due to inflammation. Managed with cool mist, corticosteroids, dexamethasone, and nebulized epinephrine. Padinare, renal, acute kidney injury. Question: which finding indicates a patient with acute kidney injury, AKI, is improving? A. Decreased urine output. B. Increased serum creatinine. C. Increased urine output. D. Hyperkalemia. Correct answer. C. Increased urine output. Rationale. Correct. Increased urine output suggests recovery from AKI. Incorrect. A, B, and D indicate worsening kidney function. Key concept: AKI occurs due to decreased kidney perfusion, pre-renal, damage to kidney tissue, intrarenal, or obstruction, post-renal. Signs of worsening kidney function: decreased urine output, oliguria, less than 400 milliliters per day, rising serum creatinine and Bayern, hyperkalemia, dangerous arrhythmias. Improving kidney function, increasing urine output is a good sign. Fluid resuscitation if pre-renal, or dialysis if severe acute kidney injury. Padinare, orthopedics, compartment syndrome. Question: which symptom is most concerning in a patient with a cast? A. Pain relieved with medication. B. Swelling around the cast. C. Numbness and tingling. D. Itching under the cast. Correct answer. C. Numbness and tingling. Rationale correct. These are signs of compartment syndrome requiring immediate intervention. Incorrect. A, B, and D, expected findings. Concept: compartment syndrome occurs when swelling cuts off circulation, leading to ischemia and nerve damage. Classic signs: 6 Ps, pain, unrelieved by medication. Early sign: paresthesia, numbness, tingling. Pallor, pale skin. Paralysis, late sign. Pulselessness, very late sign, medical emergency. Poikilothermia, cool limb. Emergency fasciotomy, surgical decompression, is required to prevent permanent damage. 18. Infection control. Question: which patient requires airborne precautions? A. A patient with MRSA. B. A patient with tuberculosis. C. A patient with C. difficile. D. A patient with influenza. Correct answer: B. A patient with tuberculosis. Rationale. Correct. TB requires airborne precautions. N95 mask, negative pressure room. Incorrect. A, C, and D require contact or droplet precautions. Key concept: different infections require specific isolation precautions. Contact precautions: MRSA, C, difficile, gown, gloves. Droplet precautions: influenza, meningitis, mask, gloves. Airborne precautions: TB, varicella, chickenpox, measles, N95 mask, negative pressure room. Always wash hands before and after patient contact. 19. Stroke, right versus left side. Question: which symptom is most concerning in a patient with a stroke? A. Left-sided weakness. B. Slurred speech. C. Sudden severe headache. D. Facial droop. Correct answer: C. Sudden severe headache. Rationale, correct. A severe headache suggests a hemorrhagic stroke, which is more life-threatening. Incorrect. A, B, and D. Expected findings, but not as critical as hemorrhage. Key concept, strokes at sea. A cause brain damage, and symptoms depend on the affected side. Right-sided stroke, left-sided weakness. Impulsive, poor judgment. Left-sided stroke, right-sided weakness. Speech, just language deficits, aphasia. Thunderclap, headache suggests hemorrhagic stroke, requires emergency care. TPA, thrombolytic therapy, can be given for ischemic stroke within 4.5 hours if no contraindications. Yudubada. Shock, septic versus hypovolemic. Question. A patient with suspected septic shock has a blood pressure of 80/50 millimeters of mercury, heart rate of 120 beats per minute, and temperature of 103 degrees Fahrenheit, 39.4 degrees Celsius. What is the nurse's priority intervention? A. Administer IV fluids. B. Give acetaminophen. C. Start vasopressors. D. Obtain blood cultures. Correct answer. A. Administer IV fluids. Rationale. Correct. In septic shock, fluid resuscitation, IV crystalloids, is the priority to restore perfusion before starting vasopressors. Incorrect. B. Acetaminophen helps reduce fever but does not address shock. C. Vasopressors are given after fluid resuscitation if blood pressure remains low. D. Blood cultures are needed but not the immediate priority over stabilizing BP. Key concept. Septic shock is caused by overwhelming infection, leading to vasodilation and hypotension. Key signs: high fever, hypotension, tachycardia, warm, flushed skin. Priority: aggressive IV fluids, 30 milliliters per kilogram crystalloid bolus, before vasopressors. Hypovolemic shock occurs due to blood/fluid loss. Signs: cool, pale skin, tachycardia, hypotension. Treatment: rapid fluid resuscitation, normal saline or lactated ringers. Early recognition and fluid resuscitation are crucial to prevent organ failure. Great job! Keep practicing, stay confident, and you'll be one step closer to passing the NCLEX. Don't forget to like, subscribe, and hit the bell for more.